Musk of dentistry these days, all over the place. Thank you for coming back to the cast. Today, we got a very exciting topic that we would like to address, and it's a groundbreaking innovation that is kind of mind-boggling to me, where we are able to prevent the formation of decay. And I'll get into those details a little bit, but to familiarize you guys with our speakers today, um, Dr. Arash is not new to this podcast series. He has presented numerous times, and he's involved in many, many entities and has a long history of clinical, educational background. And Dr. Emily Stein is going to be, I'm going to read you guys a little bit of her bio so you guys get an understanding what Dr. Stein has done. She has been working to refine the landscape of oral and systemic health. Her leadership has been driving cutting-edge microbiome modular products while unraveling the intricacies of biofilm-related oral and systemic diseases. She has founded multiple biotech startups, addressing challenges in the field, including the sympathetic nervous system, infectious disease diagnosis, exosome biology, cancer diagnostic, pulmonary fibrosis, and more. Her credentials are quite lengthy. It would take me all day to read them, but she has 18 patents, guys, and has delivered over 23 lectures on a global stage. And she has brought her ingenuity to our profession of dentistry. It's a great honor to have her here. I'll give you guys a little bit more background. She has a bachelor's in anthropology. It's a nice field. I did some work in that. Uh, and she has mostly focused on interactions between tuberculosis, alveolar macrophages, laying down the foundation for her future scientific endeavors. And she has also earned a PhD along the way in microbiology at UC Berkeley. Her research focused on serine, threonine, and tyrosine kinase dependent signaling pathways in bacteria and biofilm development. Starting to remind me a lot about the Krebs cycle and all that stuff that we learned in school. But a very unique approach to the topic that we will discuss today in preventative care. So, just to get started a little bit, Dr. Stein, I have one more announcement. As to housekeeping, we are going to be announcing the world's top doctors of the class of 2024 today. And as you guys know, the individuals that are within our society are the ones that are presenting, and Dr. Stein has also been elected by the election committee to join this class and conduct the first special polling hour of the holiday season. Um, so, Dr. Stein, first and foremost, what is your motivation? How did you get involved in dental decay and things of that sort? Please give us a little background.
Yeah, so I'm obviously not a dentist. My patients are more on the 2 nanometer to 20 nanometer side of the spectrum on the end of a microscope. So I was actually a postdoc in rheumatology at Stanford, studying autoimmune disease when my grandmother had a stroke from a tooth extraction. And it turns out that there are publications about 10 years ago now that show that retrospective analysis of thousands of Medicaid claims have shown a 50% increased risk factor of a heart attack or a stroke after a tooth gets extracted or an implant gets placed. And that risk extends for 4 weeks after the surgical event. So sadly, my grandmother was a statistic, and that's what really alerted me to the problem that is, preventative dental care. There's an unmet needs, and so I rolled up my sleeves about 13 years ago, trying to figure out the causal effects of decay and gingival inflammation.
Wow, very impressive. So there's actually motivated by family member. That's very noble. And how did you run into Dr. Hakhamian? How did you get Dr. Hakhamian? How did you get interested in this product?
Well, as you know, I run a teledentistry company that's very focused on preventative care. And I had heard about Dr. Stein through Delta Dental and some large organizations who are just raving about her. And so I had the pleasure of flying out to Minnesota and meeting her in person because I heard she's going to cure cavities. And I was like, who? I've heard this before. We hear this all the time. But when the actual insurance companies and larger government institutions start raving about it, I obviously thought maybe there's something there. So I flew out and I had a pleasure of listening to Dr. Stein and her unique way of um, impacting the oral microbiome and really her innovative approach on how we manipulate pathogens, not only strep mutans and karyogenic bacteria, but also periodontal pathogens, candida. Um, and I think we as a profession have always been in the mindset of killing. Let's kill all the bacteria. They're all bad. Let's just murder them. Alcohol, chlorhexidine, antibiotics. And we now know that that doesn't really work, right? We've tried that to death. In fact, Harvard just had a incredible article on the front of Harvard Magazine. I invite everyone to read it. That said that you are what you feed your microbiome, and really the only way to impact the microbiome in a meaningful way is what we feed it. So that really resonated with me, and Dr. Stein's approach is just that, is affecting the way that these bacteria metabolize food. And so when we have a candy bar or when we have sugar, right now they eat that sugar, they poop out an acid, and that acid causes cavities, and that has downstream impact on candida and periodontal pathogens. So Dr. Stein's approach was to not kill, but to affect the way that these pathogens metabolize food. And I think it's revolutionary. And so I've had the honor and privilege of coming on as the chief dental officer and now working with Dr. Stein to get other clinicians involved. And we have a massive growing support from really incredible clinicians and now from institutional players. So we definitely want to make sure that this benefits not only our patients, but also the dental professional. So my goal in being involved is to make sure that we as professionals, as dentists, figure out how we can benefit from this as well. Not just our patients, but how do we decrease implant failures? How do we increase the success of root canals? How do we use this in professional applications that can help us improve the care that we deliver? And at the same time, just really encourage Dr. Stein to continue with her research and help hopefully eradicate dental decay.
Well, that would be a dream come true. You said something about having heard these kind of things in the past before. Yes, indeed. And I mean, I've been hearing these cures for decay and stem cells and all this other stuff for the last 2 decades. I've been in clinical practice, but when you sat down and you actually explained to me that you're not killing bacteria, you're starving them, and you're interfering with their cycle of sugar it's brilliant. And I think it will have a tremendous impact on the way we do preventative once it becomes mainstream. So I wanted to get into more targeted questions for you guys. You have the can you show us what it looks like, maybe how it comes in and what the
Yeah.
different scenarios are
Yeah,
there?
so the great thing about this, it really comes in a powder form, and it can actually be incorporated into just about anything. What's really important, some of the high level stuff before Dr. Stein goes into the detailed explanation of the mechanism of action. So these are some major highlights. Is that this is a plant-derived prebiotic. It's simple amino acids that are put together. These are things that are naturally found in nature. So these are not drugs. These are not pharmaceutical, medications that need to be prescribed. And so they simply just use what nature has been doing for millions of years. So I joke around and say our products have been tested for millions of years and show efficacy. But really, it's a prebiotic. Right now, you can purchase these in the form of mints. So patients who are Alzheimer's patients, for example, that just don't brush and floss, or let's just keep it real, all of us, like, do we, even as dentists, do we really brush and floss after every meal? If you go out, you know, it's this is easily something that can be taken as a mint and just dissolves on the tongue, and the bacteria bind to this. They think it's sugar, but it's, you know, it's actually in a structure that binds to those receptors, and it cannot be metabolized. So the bacteria grab onto it thinking it's food, and they don't let go because they think it's food, and they're unable to process it. So we're essentially just putting bacteria on a keto diet. And so that's really the main form is right now just taking it as a mint, but this is now going to be put in toothpaste and mouthwash and gum and strips. And in
So that's for your patient pool, right? This is
That's
the
for
patient
patient
pool.
pool. Yeah,
What about the doctors? Or can you apply this to instruments, implants, anything of that sort? Or is this
absolutely, absolutely. And again, I think Dr. Stein is going to go into this stuff, but I'm so excited as a dentist because we've already successfully put this in O ties. So now our orthodontic patients, when they come in to change their O ties, the entire time over that 30-day period until they come back, it's releasing this anti-cavity property. And so we're seeing reduction in not only cavities, white spots, demineralization.
white spots? That's a big problem, you know.
That's right. And we've successfully put this inside clear aligners. So companies like Invisalign, every single time you change your aligner for that duration of the 2 weeks that you're wearing it, you're actually helping reduce cavities. You're helping reduce the potential for gum disease and for candida. And it helps with decreasing the biofilm formation on our oral appliances. So there's lots of cool ways that this can be incorporated in dentistry. Right now, I know there's people researching this as an irrigation. So when you do root canals, you can actually irrigate the canal, and all the bacteria that are stuck in those little canals actually will grab onto this, thinking it's food, and they will actively transport it in all those lateral canals. So it will shape the way that the biofilm and the microbiome within the canals are formed for root canals. It actually can be incorporated into bone grafting materials, collagen membranes, sealers. I mean, it's really a vast number of applications, but the mechanism of action is very simple. It stops sugar metabolism. And there are many things that use sugar metabolism as part of their metabolic process. So cavity causing bacteria, yeast, periodontal pathogens. So it's really a vast ocean of different applications. And part of what we're doing right now is working with partners that are interested in putting this protectant inside their own formulations and bringing this out to the market in different forms.
Amazing. I mean, the opportunities, the options here, from what it sounds like, are limitless. So this is nothing new, Dr. Stein, right? Thank you, Dr. Hakhamian. That was great
My pleasure.
to like that. Um, Dr. Stein, you've been doing research on this for over a decade, right? You have a lot of research. Tell us a little bit about that, so we kind of understand what's behind this in terms of academics.
Yeah. Well, over the past 13 years, we've accrued over 8,000 different pathogenic biofilms from the mouths of dogs, cats, humans with different diseases, abscesses, periimplantitis, significant caries lesions, thrush, mucositis, gingiva and characterize the microbes, along with doing high throughput screening of any natural safe ingredient I could get my hands on for my grandmother, right? So that was 2 years of life thousands of dollars spent on sourcing ingredients and doing high throughput screening, looking for things that would block microbial acid production, which is one of the leading causes of enamel demineralization, and also stimulate build up of beneficial microbes, because in rheumatology, we know that inflammation goes way up when the number of good bacteria go way down, and there's an inverse relationship. So my biggest goal was finding naturally safe ingredients that blocked karyogenic pathogens and subgingival pathogens from secreting things that cause problems and inflammation, but yet stimulating the growth and the outgrowth of beneficial protective microbes for the benefit of the host. And we've done now numerous clinical studies, different form factors, both in the water additive and as Dr. Hakhamian said, in the lozenge format, and have shown significant clinical benefits and a reduction in gingival and karyogenic pathogens, which is exciting.
Wow, wow, wow. This is really, truly groundbreaking, ground moving, ground shaking stuff for dentistry. And this is not just applicable in dentistry, right? You are actually looking at this for animals and other professions.
That's
Is that
correct.
correct?
Yeah, that's correct. We have proof of, yeah, we're in the market on the animal side already as a water additive. We've got cat and dog, and we're working on horse, believe it or not, and because there's a lot of downstream effects if a horse has an abscess. And then we've learned a lot from improving the oral microbiome in humans, and that's led to downstream gut health applications, as well as women's health applications, in addition to dermatology applications.
You know, just off the top of my head sitting here, you know, there's a big debate about water fluoridation in the world, and it's a constant point of contention between the medical community, the government agencies, and the public. I wonder if this, I already know you're putting this in certain soda drinks and waters and so forth, right? To minimize the effects. But this could be anywhere. It could, is it very expensive to make? Is it hard to make? Is this something that could be done in like a water fluoridation scenario? I think it would be a lot more beneficial than fluoride and all that other stuff you put in there.
Absolutely. It's very scalable. These ingredients that we have a patent on have been around for, I mean, that fiber that Dr. Kamen was talking about, that's non-fermentable, that microbes grab onto thinking it's sugar and can't bring it inside to eat it. That's been discovered since 1910. And it's been used in anything from foods to IV medicines to Febreze. It just happens to be produced by a soil microbe as a postbiotic to compete against sugar-loving microbes in the soil, and we're just repurposing it.
I'd like to point out too, which was really incredible, because Dr. Shah, you know, we all thought it's going to be a vaccine that comes by and someone's going to cure cavities with a vaccine. And we're not at that time, we're not even currently saying this is a cure for anything. That requires
Don't use the
FDA
word cure for
approval.
anything.
But yeah, and so we're not making any claims of curing anything, but we have over 10 years of studies that show that it works in stopping sugar metabolism, and it stops karyogenic bacteria, you know, in their ability to make acids, and it stops Candida, you know, and it stops downstream. It has an impact on periodontal pathogens. That we can say, and we're now going through the regulatory process of being able to very soon be able to say publicly what we already know it's doing, which is, yeah, you know, curing an issue. So at this point, the validation also comes from an organization I can't mention publicly, but that goes to outer space, and who's been using this in outer space for several years now. I mean, they love it so much. They take these lozenges, the same ones that are now commercially available, and they take it after breakfast, lunch, and dinner. And so, you know, we have validation by some of the institutional players like insurance companies. The Medicaid system is doing a huge pilot with this. And we have interplanetary travelers that are using this in outer space now. And that will too become publicly available information very soon. But I think this is a huge opportunity for us dentists to really, really help our patients. And where dentistry is today is no longer about just teeth and white teeth and veneers. Dentists are now impacting the overall health of our patients. We have a direct impact on the rest of the body. We have research coming out about oral bacteria, affecting Alzheimer's and dementia. We already knew about premature birth, fertility. Dentists already very well aware about bacterial endocarditis in the heart valves. So there's an intricate connection between the oral cavity and the rest of the body. And this product now helps us improve the general wellness and health of the patients downstream and have a very immediate and direct impact on the oral health. So when you mentioned putting this in different things, I currently put this all over my food. I got the powdered version. And one of the perks of being a part of this company and I invested in the company as well. As a dentist, I couldn't wait to actually invest in the company. So I invested in this technology. And so what I got in return for my investment was a bag of the powder. So I put it in like a salt shaker. So now I put it on my drinks. I put it in my food. When I have something that has lots of sugar in it, I put that on anything that I consume now. And I certainly see the potential for putting this in city water, in bottled water, and incorporating into candy, gushers and gum and lots of different applications. And the last thing I'll say on it is that you only need a little. This is micro dosing. So you don't need tons of this. And so we're able to get it in small amounts into a variety of different delivery models without having to overtake the flavor or change the general composition of things.
Wow. Okay, so you invested in a company. That's wonderful. I'm sitting here as a dentist and I'm excited. I'm a believer. And I want to get involved with this organization. Who do I contact if I wanted to do research, if I wanted to invest, if I wanted to use it on some of my patients and get started to look at some of this. The good thing about this product, like you said, Dr. Hakhamian, over the last 20 years, I've been hearing all these solutions. Yeah, we're gonna drop some stem cells in the cavity and magically it's gonna make the cavity go away. So it became sort of redundant, but this is based on a scientific method. It's proven, it's repetitive, that you can do the experiment yourself and expect reasonably verifiable, repeatable results. And that's what we love as doctors, is things backed by science, things that are based on a scientific method. So I want to get involved with the company, two fronts. One, I'm a patient. I want to get this product for myself and my family. And some people that might not believe in fluoride products might want to look into this. Um, how do I, yeah, give us an idea how we reach out to you guys so our audience knows.
Yeah, anybody can Google Protectin, Protektin, or go to our URL, protectin.com.
Okay.
There's different ways to get involved, and I think the company obviously has gained the interest of large institutional companies from the ones who manufacture sodas, the ones who are manufacturing the large gum manufacturers, the large distributors of chocolate bars and and cereals. They want to put this everywhere. And on the pet space, we have the largest companies that have now started negotiating term sheets as a water additive, alluding this into chew toys for dogs. I think for this particular audience, since we do have tons of medical doctors around the world that are going to be watching this, I think people who are interested in women's health, who are interested in addressing UTIs, who are interested in addressing chronic yeast infections, or people who are interested in wound infections, certainly can start engaging the company as potential advisors. And that's something that I think is still a little in the near future. But currently, I think what we have in our hands is over 10 years of clinical and scientific data that shows efficacy in dentistry. It has animal testing that's been done that's been able to support this. It's a non-toxic plant-derived formula that is now being tested in scale with the Medicaid system nationally and is on track to get FDA approval. Not that it needs it, but it is something that we feel is important to be able to introduce as something that actually can cure cavities and can actually cure Candida. So you know, xylitol has been extremely successful over the last 30 years. It's in everything. Still doesn't have FDA approval. But because we have the patents and capabilities to take this through FDA, we certainly want to. So this will be commercially available through Dentulu. I'm very proud to be the first company to commercialize this. There are many other companies who are looking to put this in their products. This is a non-exclusive, so we hope to see Colgate and Procter & Gamble and Coca-Cola and Wrigley's and anyone who's interested in improving the lives of their customers to put this in their products. And hopefully we can reduce some of the decay that's caused by these sugary beverages. And in dentistry, we are looking for advisors who want to incorporate this in surgical procedures. Test this out with membranes, test this out with implants, test this out with sutures, and endodontists who want to test this out with sealers and irrigation. And so we're looking for those collaborative partnerships, and I'm very happy to say we have some really big players involved now doing clinical testing and taking this through the FDA track for those professional applications.
Amazing. If you guys don't mind, at the end of the podcast, I will place your contact information in the chat box for all of our colleagues that want to help you guys along. It's truly an honor to get to know you, Dr. Stein. As you know, dentistry is a silent epidemic. Just alone on the tooth missing teeth, 1 out of 3 Americans in the first world is missing at least one tooth. And nobody's talking about it, and everybody goes about their business and their overall health, all this health problems we have, and we're making all of these big pharma companies very wealthy is comes from the problems that are associated with what happens in the mouth. And it goes from the mouth to everything else. It's connected to everything. And what you guys are doing here is just historic, and it's an honor to know you. Sorry about your grandma, but she opened the door for something big for humanity. So I thank you for that. And if you guys are ready, I think it's time to move over to a more scientific presentation by Dr. Stein. I'm gonna hop out. With that basically said, Doc, you have the floor, and let's get started with the magic here.
Okay, great. Thank you, guys. I'm going to share my screen. All right. Can you see this? Okay, so I'm just going to take today's Facebook Live and go and take you guys on a deep dive into the oral dysbiosis and how we're going about thinking and actually treating and preventing it. So just as a primer, the oral microbiome is all of the microbes that inhabit the oral pharyngeal cavity. It depends on the person, but it can be either the second or the third most abundant microbial compartment in the body, second only to the lower GI tract. It is the second most diverse microbial community. Actually, 90% of the living cells in the mouth are microbial. Only 10% are human. And these microbes are, you're familiar with the stats. About 80% of humans have had a cavity. About 47% of Americans have gingivitis, adults. And in perio, it's age-related, but it can, and country-related, but it's anywhere from 42 to 92% incidence rate. And the reason is the microbes, you get dysbiosis, you wind up getting inflammation, and then you wind up getting deterioration of tissue. And the microbes, that lead to gingivitis and gum disease are now linked to very many systemic disease, such as cardiovascular diseases, diabetes, premature birth, erectile dysfunction, arthritis, autoimmune diseases, certain cancers, dementias, pulmonary issues. Then the main reason is these pathogens in the mouth don't stay in the mouth. They hijack either our nervous system through the vagus nerve or the circulatory system or the lymph system and travel to distal sites to cause local inflammation at those distal sites. So, and that's why the inflammation spreads and decreased lifespan occurs. And so what we're really focused on is trying to grow the good and stop the growth of the bad. And as you guys know, you can take a molecular sledgehammer to these microbes and they're not going to go away, right? They're going to, by a 3-month callback, they're going to be prevalent again because they keep on growing. And so what we're really trying to do is change who's living in that mouth to prevent leaky and bleeding gums, to prevent teeth from being extracted, to minimize the number of deep cleans you have to give patients, and to really promote appropriate and longevity of dental implants. A lot of what's going on is actually in this slide. And I know it's a complicated slide, but on the left-hand side is a normal, healthy, balanced microbiome that results in thin film of plaque on all tooth and tongue surfaces and even subgingivally. And where you do have sugar-eating microbes spewing out some acid, but that's held in check and in balance because there are a certain number of beneficial microbes that are counterbalancing it and keeping the karyogenic microbes, for instance, in balance and in check. And that homeostasis is what a healthy mouth results in a healthy mouth. Now, that's also a high diverse population. What happens over time or with stress or diet, exposure to antibiotics or a lot of antiseptics or preservatives in foods really drive the diversity down. So you go from a high diverse population to a really narrow diverse population. And with that, in the presence of table sugar, glucose, fructose, lactose, you're going to start to see an uptick in candida. You're going to start to see an uptick in strep mutans and other streps, some staphs. And with that, you usually increase the buildup of plaque. Villanella starts to get out of check. So then you start to get a little bit of bone erosion going on and demineralization of tooth enamel. And concomitantly with that, you get leaky gums or bleeding gums and gingival inflammation. And so what we're really trying to do is stop this entire disease process from happening by repopulating and diversifying the oral cavity only through diet. We're not administering a probiotic. We really are growing stuff. And whoops, there goes my dog. And this is an example of how you're giving everything on the market in the dental hygiene category has an antiseptic involved, and that antiseptic has a skewing mechanism on the microbial community. And so in this case, it was a periodontal subgingival population we pulled from a dog with advanced perio, gave it the best dental chew on the market, or what's used successfully in the vet market is delmopanol, chlorine dioxide, which is also in the human market, cetylpyridinium, which is, in Crest toothpaste, and alcohol rinses. And you can see how they skew that subgingival biofilm. In this case, this is all multi-drug resistant spirochetes in the cetylpyridinium, as opposed to our approach, which is just really keeping that biofilm thin and diversely populated, not skewing one way towards the pathogens. And this is an example of actually what we're doing. So on the left-hand, this is not our data. This came out of an academic institution recently, but on the left-hand side is a green stained biofilm. Notice it's super thick and it's actually about several millimeters thick. and highly matured. And then in the presence of a rhodamine colored, which is red colored fiber, our one of our ingredients is that non-fermentable fiber, remember, called cyclodextrin. You colored that red, gave it to the biofilm, and the microbes are literally pulling that thing down through the entire thickness of that matured biofilm because they think it's food source. And so what we're really doing on one end is using trickery, using the molecular stick approach, which is that fiber that I mentioned that they can't break down, but they think it's sugar. And it's literally blocking their ability to take in any other sugars. And it's blocking their ability to break that sugar down into acid, which demineralizes tooth enamel and upsets gingival integrity. And then also we're changing the pH, the local pH, by doing that. And we're also blocking and changing that ecosystem so that no other pathogens, which tend to prefer acidic conditions, changing that pH is a really key thing to really help rebuild and reestablish beneficial microbes. Now, at the same time, as we're giving that molecular stick, we're giving them a molecular carrot, which is why we're a unique approach, because one single shot does not move that microbiome. We have to do a 1-2 approach. So we're giving them a molecular stick at the same time as a molecular carrot. And we're literally turning on protein eating capabilities in the microbiome by stimulating amino acid breakdown. That then the microbes squirt out, instead of acid, they're squirting out alkaline, nitric oxide, ammonia, nitrate, nitrite. Those are all really good things subgingivally to have present in the tissue. And then guess who can grow off of a keto diet? That happens to be the beneficial microbes that inhabit the human oral cavity. And so by doing this approach, we're really shifting what the microbiota are doing, but that's having a foundational effect on the ecosystem of the mouth and an improvement on overall oral health. Now, just, we've done a lot of work. I'm not going to bore you, but just know that even a single administration of our protectin, which is indicated here, can block sugar uptake by microbes for 3 hours. And this is sampling from a human. And you can see the concomitant breakdown of those amino acids. So we really are putting the oral microbial compartment on this keto diet, not the host. And that has a profound effect. So there's some molecules now we know from all the gut health work in microbiome that you kind of want to occur in the mouth. So indole is one of the biggest products of beneficial microbes that tend to calm down tissue. And we're seeing that increase in the mouth after a single administration. And interestingly, TMAO, which is one of the biggest precursor risk factors of cardiovascular disease, a single administration of this is able to decrease that significantly in the mouth of people at risk. And it has a selective effect, which is really, really cool. So the fact that strep mutans and all these karyogenic microbes or candida, they really honestly don't like to grow on protein. They much prefer sugar. And you can see in this example of how we're selectively, we're selecting for growth and maintenance of good microbes like lacto. We're just blocking its ability to make acid. And strep mutans really is not doing a good job surviving these dietary conditions. And have you ever wondered why you're giving your probiotics to patients and they don't tend to have an effect on your patients? That's because of pathogenic biofilm that exists in the mouth. They're secreting things that are not allowing beneficial microbes to grow. So in this example, we took periodontal pathogens, grew them up from someone's mouth, took the supernatant, put it on a culture of probiotic. You can see it almost killed the probiotic. In this example, on the right-hand side, we pre-treated that periodontal biofilm with our protectin, took the supernatant and then put it on the lacto probiotic, and you can see they flourished. So we're foundationally changing what the microbes are doing by putting them on this protectin diet. And in canine studies, as an example, we can have a profound shift starting within 5 days. You can see these are data from an external partner of ours called Animal Biome, but they were able to show just daily administration of this in water was able to downshift Porphyromonas species burden in swab samples significantly. And at the same time, starting to expand the compartment of beneficial microbes. So we really are foundationally affecting dysbiosis. And on a 30-day study, we've done numerous studies over the past 5 years in canine, and you can see within a 30-day time point, we're getting rid of a lot of potential risk factors from a pathogenic standpoint and significantly de-risking that oral microbiome. Speaking of dog, Cash. And then in this study, we've done numerous, including year-long studies, placebo-controlled, and you can see over time in a 300 dog study that we don't seem to be picking up any resistance profiles. And over time, we are definitely enriching for beneficial microbes in dogs' mouths. And that's super important just because as in humans, most dogs don't get their teeth brushed, right? And they get their teeth maybe cleaned once every few years. And in this case, we have multiple cases showing significant benefit just by putting them on this dietary shift. So you can see at baseline, this dog in Singapore has abscess, severe perio, and a tooth. And within 14 days, we already started to quiet down that tissue and also change the constitution of that plaque. So it looks a little bit more thin, and it starts to break down a lot of the tartar. The microbes do that themselves, it turns out. And similarly, dogs with severe gingivitis, decreased gingival inflammation occurs, even where there is no plaque or tartar causing the problem. So we really are, by this dietary change, we really are having a dramatic effect. And that is now showing itself out. And just as Dr. Hakhamian was mentioning, we can put this technology in other things. We've learned how to put it in baked goods. In this case is an example of a dog chew exposed to periodontal plaque, and you can see that dog chew induced more periodontal plaque growth unless it was in the presence of our protectin, and you can see a significant decrease in periodontal pathogen outgrowth and burden. Also, we mentioned O-ties. This is an example. We've learned how to 3D print embedded in resins, and it elutes over a period of time, either acutely over 14 days or over a 30-day period, which makes it ideal for various orthodontic appliances. And then this is an example carrying into the orthodontic appliance. This is an example of Candida that was in a 17-year-old male's Invisalign aligners that we cultured over a 4-month period. You can see by day 60, we had already nearly eradicated the C. albicans in his mouth, and he was just taking the 3 lozenges per day. And then we've done numerous studies showing that we really are indeed having a global effect on pathogens that are harbored in the mouth, including multi-drug resistant enteric bacteria, MRSA, not just strep mutans, karyogenic, and Porphyromonas periodontal pathogens, but we're also in growing beneficial microbes, for instance, and that has a really important effect. In another clinical study we've done in gingivitis, older adult vulnerable patients, the endpoint we compared ourselves to, so in one cohort was one of our active formulas, and another cohort was sugar alcohol. Everybody coming in had mild to moderate gingivitis. They all had periopathogens. We did salivary testing, and these are the endpoints where you can see where the lozenge recipients, they had very little PG at the end and no AA measurable compared to the sugar alcohol cohort, which is super important. And some of the other data we've seen clinically, significant reduction in gingival index scores, lower bleeding on probing, significantly decreased rates of, the red complex organisms. And, we're making that dental plaque a lot healthier. And that has a profound effect on overall health and potentially systemic health, which is what we're getting into next. This is just another example showing that the plaque itself is changing. So there is a little bit of residual healthy plaque. You need that. We know for gingival and oral health and hygiene, you need good plaque. And you can see we're actually transitioning pathogenic plaque into a beneficial plaque. And bleeding on probing goes down within 6 weeks. So that's really impressive in patients that couldn't take care of their own dental hygiene on a daily basis. So, just kind of touching on what we've seen over the past 13 years. And I just want to just kind of reiterate that through our approach and what we're learning is the best way to influence the oral microbiome to impact dysbiosis really is to change its diet. And that can have a profound effect on decreasing pathogens really quickly. And then also growing up beneficial microbes to protect that patient. And we can help get clinical outcomes, change the outcome of patients and really improve outcomes for your patients and for their loved ones, because we're finding this infectious disease is shared amongst households. So if someone someone who's a patient has a problem, more than likely the microbes are being spread throughout that household. So you should be wary of trying to treat that household at the same time. And with that, yeah, I'm happy to take any questions if there are any. Appreciate your time, and I'm going to stop sharing. Oh, you're mute.
Thank you so much. Your presentation is being amazingly received. We are looking in the background, and you have had close to 300 shares already by doctors in different groups.
Wow.
It's probably my dog barking.
One of our records. I think the medical community is going to be very fond of your vision and dream to help some close to 8 billion people that are suffering or subject to these problems. And we are at the top of the hour, actually. I will go ahead and list some information about you guys for people to be able to reach out to you. On those three things that I would think as a dentist, how do I get involved? How do my patients get involved? And in a two-pronged approach, how can I acquire it? How can I help you guys grow? And hopefully you guys can address their questions and address their inquiries accordingly. If you guys don't mind, I'll put you guys' email addresses out at the bottom.
Thank you,
And
Dr. Shah. Thank you for the opportunity, and congratulations, Dr. Stein, being voted as one of the top 100 doctors in the world for this year. And it's been such a pleasure. And Dr. Shah, thanks for giving us a platform to share more about this revolutionary, product. And we really hope that dentists first, I recommend as a dentist, enjoy this and give this to your own family, from pediatric patients all the way up to geriatric patients, even pregnant patients. It's completely safe. And so we don't have to worry about, introducing any kind of like harsh chemicals into our body. So I'd say first and foremost, I'd invite everyone to just use it and enjoy it. And once you see the benefits, like so many of us have, then at that point, I recommend sharing this with your patients and showing them that you're their best advocate. And hopefully in the near future, you'll get to introduce this into your actual procedure. So looking forward to it. And will be commercially available for the first time in the next week or two. And you can find more information at protectin.com, PROTEKTIN. And these will be on sale also at dentulu.com and on Dentulu's marketplace, and hopefully everywhere very soon. Thanks to your help.
thank you so much for the kind words. This is what the doctor movement is about. We solve problems for patients and doctors. If you don't have a Nobel Prize to give you, Dr. Stein,
Yeah.
I think that's certainly forthcoming in the years to come. I'm sure you'd make a great candidate. Thank you guys so much for your time on a Sunday. We look forward to having you perhaps on a show in a year or two from now to see how things are progressing. Thank you so much.
Thank you
Thank
so
you.
much.
Bye-bye.
Yeah,
Bye.
bye.